So it's a great honor to be able to speak a bit about the status of this important investigation and to be joined, even in this time of social distancing, with Indigenous leadership that have come today because, as they've indicated to me in the last 3 weeks, this is an issue of urgent concern. The issue of racism, and Indigenous specific racism in the British Columbia healthcare system. As members of the media who are on the line know, less than about 3 weeks ago, I was appointed by Minister Adrian Dix to conduct an independent investigation into some specific and highly disturbing allegations of racism in BC hospital emergency rooms, and also to take a wider look at anti-Indigenous discrimination in the provincial healthcare system as a whole. Since then, I've assembled a small team, and we've been busy mapping out the investigation, and we've been working closely with representatives of First Nations Health Authority, Métis Nation and BC, communities, leaders, and individuals who have already reached out to me to talk about their concerns about how they or their loved ones were treated in the healthcare system in BC. I have to say today that this investigation is not trying to determine whether racism exists in BC's healthcare system. It does exist, just as it does in every aspect of Canadian society. What we want to gauge through this investigation and this process is the range and extent of that racism, both individual and systemic, and how it affects the quality of healthcare for Indigenous people in this province. What we want this investigation to accomplish, besides shedding a much-needed light on this issue, is to make some sound, informed recommendations that can address racism in the healthcare system and can improve the experiences of Indigenous people, First Nations and Métis, or Inuit people if they're in our province, who are accessing that system. The review will be conducted in stages. We are now into a focused investigation on the specific allegations around the game that was played in the emergency rooms, which has allegedly involved staff guessing the blood alcohol levels of Indigenous patients. These are obviously very serious allegations and an egregious example of racism that demeans and devalues Indigenous people and our health. Our investigation will get to the bottom of those troubling allegations. However, I also want to caution that the investigation is not about blaming and shaming. Blaming and shaming is something that Indigenous people have experienced, and we certainly are not in the position where we want to reflect that back. That's not a healing process. That's not a truth-telling process. It is about truth-telling, and it's about doing the investigation and presenting an accurate report on the state of anti-Indigenous racism in the BC healthcare system. I can say, though, if I do find that there have been violations of the criminal code or the standards of health professions and health professional bodies, as I look into these investigations, I will report that to the appropriate authorities to be dealt with by them. And I am pleased that BC's professional healthcare bodies overseeing doctors, nurses, and others in the system have voiced strong support for this investigation. Unequivocal, strong support. They have also assured me that if presented with evidence of wrongdoing, they will take appropriate measures. Our investigation will no doubt uncover some difficult truths, but ultimately it's about building up the confidence for Indigenous people in BC's healthcare system and to ensure that they will feel safe and that they are treated appropriately, respectfully, with dignity, equality, and fundamental respect for their human rights. The very last thing that I personally would want to do, or any of us standing up here today would want to do during this difficult time when we're dealing with two major health emergencies in British Columbia, the COVID-19 pandemic and the opioid crisis epidemic. The last thing we want to do is discourage people from using the healthcare system. One of the important messages I want to send out today is do not hesitate to seek and get the health care that might be needed if you're an Indigenous person in British Columbia. We are investigating issues. We are launching today a process to address it, but do not hold back in fear. You must seek the support you need during this time when there are very significant health crises facing Indigenous communities, and the Indigenous communities in British Columbia have been working very hard with the First Nations Health Authority and the Provincial Health Officer and others to maintain the safety of their citizens, and that challenge will continue to face them for some time. At the same time, our system clearly needs work. Our team is beginning to dive into the stories that have come forward and the treatment that Indigenous people have received, often inferior treatment. Despite having no formal presence until today, our investigation has already received countless phone calls, emails from people sharing their stories, and I'm very grateful for that. I want to assure all Indigenous people that you are safe to share the story with myself, my team. It will be treated with utmost confidence and respect. It is independent from government. There will be no retaliation or recrimination to anyone that does that. You will be supported. And in the same vein, anyone working in the healthcare system that needs to share their experience and story with what they may have been a bystander to or participated in, I encourage you to share that information. You will face no recrimination in your workplace for doing that, and you have my sincere pledge on that. That's a very strong stand, and the Minister of Health has also affirmed that. Today as well, we launch a website. We will launch a survey. One of the roles of this investigation is to look at anti-Indigenous racism. It is a monumental task. It isn't a new thing. We are today launching a survey, and we are encouraging Indigenous people to complete the survey. The survey is independent from government. The survey will look into whether or not Indigenous people have experienced racism, the nature of that experience, and so forth. Not everyone will want to tell their entire story, and I can understand and respect that. But I urge and encourage you to complete the survey. It's very important that your voice be heard. You do not have to give me your personal story, but by completing the survey, by supporting people in your family to complete the survey, by calling me or the number that you're going to see on the new website that's been launched, we will support you to complete the survey. But we need to know the full extent of this experience in British Columbia, and we need you to take this opportunity to speak up. We'll also be looking at the stories of individual racism and systemic racism. And we are looking at data in the healthcare system, speaking, as I said, with healthcare workers and leaders to get a better sense of what needs to change in that system to make it better, to make it safer, and make it more welcoming and respectful for Indigenous people, and for Indigenous people's ways of approaching health and well-being, Indigenous knowledge. And again, I'm honored to be here today with Indigenous knowledge keepers who have traditional Indigenous knowledge on health. May not always appear in the mainstream, but it's very significant, and they've told me today, and Indigenous people tell me every day about how important Indigenous knowledge and values and approaches to health is in addressing trauma and the needs that Indigenous people have when they go for health care. Certainly, Indigenous people want individual and systemic racism in healthcare to be rooted out. They want our investigation to help change the system for the better. I have been assured by Minister Dix that his ministry and government will implement recommendations from this investigation. This means this is a significant opportunity for change. We want to seize this opportunity in the most respectful, inclusive, and supportive way, and we want to build unity and support between Métis and First Nations in British Columbia, which you'll see here today by the people who are standing with me, but also to make sure that all Indigenous people of all ages and stages of life are treated respectfully and are heard. So again, I urge all Indigenous people to share your experiences through the survey. We are launching a 1-800 number if you need to call and talk about a case. We will follow up with you on that. This is your chance to have your say. The pace of the investigation is an intense pace over the last few weeks, and we will be working hard in the next few months. I doubt I will be speaking again to the media during this period of intense work, but I am hoping to have at least a preliminary report on these matters and a preliminary view, a first stage report available in a matter of months. And that is something that the team is working on now with Dispatch. So I thank you for that. And again, I'd like to thank those who are standing with me, providing support, that kind of important cultural support, safety, so that there can be safety for Indigenous people to tell the story of what's happened to them. To me, I've been asked to do this, not only by Minister Dix, but since Minister Dix called and asked me, First Nations leadership, Métis leadership have said, yes, we want you to do this. There's been 100% support, and I really do lift my hands up and thank you for that. And so we will do that, and we must not have any stone unturned on this issue. These are times when we must deal with racism in our society. We must respect rights of Indigenous people in all aspects of our society, and healthcare especially with the global pandemic and epidemic I spoke about earlier. So with that, I thank you, and I am happy to take questions from the media now.